Hey everyone, got another heart today. This is specimen 651 in our collection. The heart would have sat in the chest roughly like this. Anterior would have been here, superior the head up here, inferior the legs down here, left and right. So let's start off by finding the right atrial appendage, at least what we think it is externally. And this appears externally at least to be a right atrial appendage, broad-based and triangular shaped. So let's go ahead and open the heart there and start there. And as soon as we open up this heart, we do see pectinate muscles that spill outside the confines of the appendage, consistent with a right atrium or a morphologic right atrium. And as we look at the right atrium, we find the oval fossa here, and we find a few different communications or atrial septal defects within the confines of the oval fossa. So once again, here is the oval fossa, and you can see two smaller fenestrations in it and then a larger hole in the oval fossa. Then also in the right atrium, we find the mouth of the coronary sinus, which is right here. And then here is the tendon of Totaro. And then here is the tricuspid valve. And we know that the triangle formed by these three structures, once again, those structures being the mouth of the coronary sinus, the tendon of Totaro, and the hinge point of the tricuspid valve, is the triangle of Koch. And at the apex of that triangle, so right here, is where we would expect the atrioventricular node to sit. So the AV node would sit somewhere here at the apex of the triangle formed by the tendon of Totaro, the coronary sinus, and the tricuspid valve. When we look at this right-sided atrioventricular junction and the valve guarding it, it does have three leaflets, 1, 2, 3. You can see those nicely here. And it does have septal connections. So here's the septal leaflet of the tricuspid valve, and you can see its connections directly to the septum, which make it consistent with the morphologic tricuspid valve. And then we would assume that the ventricle it is connected to would be a morphologic right ventricle. There are coarse trabeculations, and there is a septomarginal trabeculation here with its cranial and caudal limbs. So all features consistent with the morphologic right ventricle. When we go to the right ventricular outflow tract, we do find a semilunar valve with three leaflets, 1, 2, 3, and 3 sinuses. I think it's important to note that the semilunar valves, at least the pulmonary valve here, which this is a morphologic pulmonary valve, is entirely supported by muscle, which is unlike the aortic valve, and that there truly isn't an annulus, as we call it, or we refer to, because truly what the annulus of this valve is kind of this semilunar hinge pattern that you see get formed, such as there are triangles of myocardium that interpose between the valvar leaflets. So really what we call an annulus in cardiology practice is truly kind of a human-made construct, and so not a true annulus. The true annulus truly is this semilunar pattern that's formed here. So nonetheless, a morphologic pulmonary valve that leads to the pulmonary trunk. Here are the left and the right branch pulmonary arteries. Then if we flip this heart posteriorly, we find an atrium that is smooth-walled with pectinate muscles confined to within the appendage itself here. So here is the left atrial appendage, and all of its pectinate muscles are within the atrial appendage itself. And so this atrium is a morphologic left atrium. And once again, we find the fenestrations in the oval fossa here. So here are 2, and here's that larger one. So now we're looking at the interatrial communication from the left side. If we turn our attention to the left-sided atrioventricular junction, we find another atrioventricular valve here. This one does appear to have 2 leaflets. It also does not have any septal connections. So here's the ventricular septum, and here's that valve. There are no direct connections, consistent with a morphologic mitral valve. And here you can see the papillary muscles supporting the mitral valve apparatus. If we take a look at this ventricle that it's connected to, we would assume that it's going to be a morphologic left ventricle, considering there is a morphologic mitral valve connected to it. And in fact, that's what we find, is there are fine crisscross trabeculations in this ventricle. So we turn our attention to the outflow tract here. We find another semilunar valve. Once again, important to note that these are truly semilunar and that there are triangles of myocardium interposed between the valvar leaflets. In the setting of the aortic valve, however, the entirety of the aortic valve is not supported by muscle or myocardium, as there is often fibrous continuity between the mitral valve, the anterior leaflet of the mitral valve, and part of the aortic valve leaflet. So here is that aortomitral continuity, which makes this semilunar valve a little different than the pulmonary valve. Nonetheless, there is no true annulus, as we consider it or call it. The true annulus of this valve would actually be in this semilunar hinge shape. Nonetheless, this aortic valve does have 3 leaflets, 1, 2, and 3, and this is that other one that we first saw cut here, and with 3 sinuses. We do see that the coronary arteries are arising from within the sinuses. And here is the other coronary back here. Right? All consistent with the morphologic aortic valve. And then here is the ascending aorta, and then some of the head and neck vessels. So a specimen with a oval fossa type atrial septal defect and otherwise normal intracardiac anatomy.